So going on to the second one, commonly a lot of parents come and ask me, oh, my child has joint pain. Can you do a blood test for my child to determine if my child has arthritis, or to do a blood test to ensure that my child does not have arthritis? And my answer would typically be, I can't really do that because we cannot diagnose arthritis from blood tests. The diagnosis of arthritis is based on symptoms and physical examination by a doctor. And after the physical examination, the diagnosis of JIA is made when joint inflammation, which is the arthritis, is present for 6 weeks or more, beginning before the 16th birthday. So when you go to a doctor, what would your doctor be asking you? So it will be the symptoms that I just mentioned to you that may suggest arthritis, as well as the physical examination. For children, they're just generally very flexible. And if their joints are slightly more stiff, that it does raise questions or concerns about the possibility of arthritis in that joint. Now, arthritis is just a little bit like a symptom, or a little bit like cough. You have cough, but it doesn't mean that you have tuberculosis, or it doesn't mean that you have lung cancer. So having arthritis does not mean you have JIA either. Okay, so there are other causes of arthritis, and majority of the causes are very transient and temporary. When we say transient, it means that, oh, it typically goes off after 3 to 4 weeks. For example, what we call reactive arthritis or transient synovitis is an arthritis that occurs as a reaction of the body to an infection that occurred about 1 or 2 weeks ago. Recently with COVID, there are a lot of kids who came down with COVID, and not just COVID, many other viruses can cause reactive arthritis. So there have been quite a few kids with this reactive or transient synovitis. And what we'll do is to give them some medication, such as ibuprofen, naproxen, or diclofenac, and monitor it. If it goes off within less than 6 weeks, then it's less likely to be JIA, and then there will be a monitoring period. So here it's quite important for us to recognize that JIA the diagnosis can't be made definitively if the symptom has only been there for 2 days, for example. Okay, so then your doctor will usually say, oh, we need to monitor for a little bit longer to be certain whether it's the sort that is temporary or transient, or the sort that is a little bit longer and more chronic kind of condition, which is the JIA.